Afternoon, North Dakota. Thanks for joining in. I want to start out with a personal shout out. We've had over 75 of these press briefings, and key to every one of them has been Mike Nowatzki. He's not here today because it's his birthday, but he's been working remotely. Just got off a video call with him. So happy birthday, Mike. Thanks for working on your birthday. Today we've got myself and our special guest today is First Lady Catherine Burgum, who'll be talking about Recovery Reinvented. We also, afterwards, for questions, both Superintendent Baszler and Head of Human Services Chris Jones will be here. For questions, let's jump right in. We know that new cases and positivity rates are still moving in the wrong direction in North Dakota, but as we have described before, we need to put this in context of where we are. Last spring, when our numbers were great, so was everybody else's in the upper Midwest, and we had perhaps the good fortune to think that this was never going to be destined for the Midwest or the Rockies, but now as some of the rest of the nation maybe gets some respite, there's a large swath of states through the upper Midwest into the Rocky region that are facing the brunt of the COVID storm right now. And of course, as we've said, other things are different because last spring we had schools were closed, universities were closed, and we were heading into warmer weather where we had more opportunity to be outside, and we were moving out of flu season this fall. Here we are in North Dakota with our economy open and our schools open, our universities open. Winter coming on, flu season coming on, and we're surrounded by other states that have record cases as well. Sadly, we know that this can be a deadly disease, particularly for those with age or underlying conditions. And there was just in our region, there was other states that set daily records for deaths on Wednesday: Iowa, Minnesota, and Montana, and Kansas, Wisconsin, to mention a few, and even Hawaii, which has been basically closed down to visitation, set a record for deaths on Wednesday. Wisconsin, Illinois, Kentucky, Colorado, and Ohio all reported daily increases in new infections, and 14 states in this region and around the country also had peak hospitalizations during the entire pandemic, including Alaska, which has also been largely isolated through this time, but Arkansas, Iowa, Kansas, Kentucky, Montana, Missouri, Nebraska, North Dakota, South Dakota, Oklahoma, Utah, West Virginia, and Wisconsin. So, however, through all this, we've been seeing that there is many positive things happening in our state. We're seeing local action supported by our state guidelines. And I think I want to, again, also focus a little bit on the White House report this week, because the White House puts out a report. They were clear in their report this week that there must be increased mitigation in North Dakota. We're seeing that at the community level, which is fantastic. They talked about how that partial or incomplete mitigation must be what's going on right now, because that would help explain the increased spread. And we know that mitigation works. There's been many, many debates about masks and mask usage and mask mandates or not mandates, but we know that mitigation works. And the most effective form of mitigation, of course, is social distancing. This is a disease virus that spreads from human to human. So if you're not around other humans, you're not going to get this disease. So that's the first thing. In North Dakota, as we joked about early on, we've got plenty of space for physical distancing. It's something that people say we've been doing since statehood, and so we've got that opportunity here in our state. When we're unable to physical distance, the White House guidelines went on to say, if you can't physical distance, mask wearing, hand hygiene, avoid crowds in public, and avoid hosting private gatherings as an alternative to avoiding crowds in public. Now, does that sound like something we've been talking about for 7 months? Because the North Dakota SMART guidelines are exactly that, which is physical distancing. If you can't physical distance, wear a mask, wash your hands often, and again, maintain distance from crowds or avoid crowds. So it's not a question of do we need a new approach, or do we need to have the White House put it in a memo versus what we've been saying here in North Dakota for 7 months? What we actually need is increased compliance or increased participation, increased motivation for participation in helping to slow the spread. So I want to announce really today to the whole state to put out a challenge, and I'll call it the Thanksgiving Challenge, because it would be really great to be sharing with all of you at Thanksgiving that our numbers are going down as we head into the holiday period, that we've got increasing amounts of hospital capacity, that our schools have remained open, that our businesses are open during that holiday season, that holiday gatherings can go ahead with families. And so if we want all of those things that we dearly love, we have an opportunity. Mitigation takes some time because the incubation period of this can be several weeks. So if we change behavior, get more people social distancing, more people being aware, more people practicing face coverings when they can't socially distance, even if we start all that today with 100% compliance, it would be a couple weeks before we would start to see, we might even see numbers go up before we saw them go down, but they would go down because places where you've had increased amount of mitigation, increased mitigation leads to lower case transmission, where all of the mitigation is about reducing the number of transmissible moments. And so we know that we have the ability to do that, so there is choices that we can all make here in terms of how we want to participate in that. And as I've said before, everybody needs to find their why on why they might want to participate, and we can stop arguing about masks or mask mandates, and all agree that our interaction with other humans and how we do that has the potential to increase transmission rates. We just know that. And so everybody has a chance, and when you're finding your why, you can look to find your why, maybe by finding what you love. If you love your community, that might be a reason. If you love your sports team that you're a member of, if you love your school and you want that to keep open, you don't want your classmates to miss any school, if you got a favorite restaurant that you like going to and you're worried about them and their future, that'd be another reason to, again, practice the SMART guidelines that the White House has been recommending, that North Dakota has been recommending, especially with the recognition that we're in the middle of a COVID storm. If you're in the middle of a winter storm, you don't go outside without a jacket. You don't. I know in our family growing up, you made sure you had a shovel in the car and a winter survival kit. When we're in the middle of a COVID storm, it'd be a good time to understand the context of the region we're in, and that now more than any time since this began is a time for us to start thinking about how we can take actions. Because there's lots of debates about how do you have increased amounts of compliance, and some would argue for more government mandates. Others would argue against those, but we do know that this virus, because if it transmits in close contact under 6 feet, then this really comes down to a family by family, business by business, school by school, community by community approach in terms of the best way to increase the amount of people that are participating in slowing the spread. And that requires leadership at all levels, and the leadership can come from people at any ages, whether you're a student or whether you're a leader in your family, your community, your club, your organization, your team. You can be the one that helps set the pace, that helps slow the spread and keep everybody safe. And particularly if we're looking for things we love, I think we all know that we have a culture where we want to respect and do respect our elders, those that have helped build our state and help contribute to our state. And those elders in our state are somebody we also, if we care about them, and whether they're living at home or living in a congregate living setting, again, find your why, find who you love, and find a reason to be part of the solution. But when we talk about leadership everywhere, we've had a number of people that have really stepped up this week, and our state is a very diverse land and diverse people. We've got areas that are densely populated. We've got areas that are vast farm fields and expansive ranch land where it can be miles and miles between neighbors. And so we know that when we're dealing with this pandemic, that it really comes down to each unique community, each county, each city has got to have the ability to make local decisions based on the risk within their community. And if the number one best way to stop the spread is individual responsibility, the next backstop behind that is communities getting together and making decisions about what they want to do to stop the spread in their communities. The past several weeks, we've begun weekly meetings, and we'll continue these throughout the pandemic. We meet with the mayors and county commissioners that represent close to 80% of the state's population, which means the counties from the large metro areas. We hear from them what's working, what's not working, what additional support they might need from the state or federals, and then we go to work making sure that they've got the resources that they need. And many of them have stepped up with their either by executive action or through their city commissions this week to take action. And we will highlight a few of those. They're working closely with their local task forces, with their coalitions, and with their local public health. Nearly a month ago, Mayor Klug in Williston took very strong action. He brought back together a COVID-19 coalition, limited permits, which again are issued at the city level for large events within the community. Mayor Decker in Dickinson took similar action by limiting large event permits in the community. It's been almost 2 months ago when we'd given a shout out to Mayor Buczynski in Grand Forks, who took the action of limiting the hours on bars closures to 11 o'clock and to help reduce the dense congregation of unmasked crowds at late night. Mayor Johnson from Devil's Lake is working with Lake Region Community College to bring together a community meeting today for ideas about how to brainstorm on slowing the spread. And I know that he's been reaching out to individual businesses in their community that have large amounts of customers to talk to them about measures that they can do at a even a store-by-store basis to help slow the spread in their community. And over the past week, we've seen action by Mayor Mahoney in Fargo, Mayor Sipma in the City Commission of Minot, Mayor Dardis in the City Commission of West Fargo, and Mayor Carlsruhe in Valley City, all taking actions to address increased mask usage in their communities. We've also seen chamber organizations step up from across the state and taking leadership with their membership to urge increased mitigation within businesses to help us keep those businesses open. We know that others are considering action and taking action, and we as a state stand by to support all these communities and their leaders in the tools that they need to help slow this. Because again, if there's something else that you love, and you love the health workers in your community, whether they're in long-term care or whether they're in the hospitals in your community, it's another reason we can continue to help them out by making sure we reduce community spread, because that takes a load off of those people who work in healthcare. Again, we know there's a lag time before the impact of those changes, so we want to see positive impacts. We expect that we'll see those several weeks out from now. But in the meantime, there's one other piece of advice we've been giving to people all along, and that's if you're not feeling well, please stay home if you're sick. Because while you may think you just have a cold, it could be COVID. You may think you just have the flu, it could be COVID. And you're interacting with other people when you're symptomatic could lead to others getting sick, which lead to others getting sick, which leads to dozens, if not hundreds, of new cases down the tree of infection, if you will, and that puts pressure on our hospital situation. So one of the simplest and kindest things we can do for each other right now is to make sure that we're being, again, as we said, North Dakota smart. This is not the time to be North Dakota tough and go to work when you're not feeling well. We're certainly grateful to all the schools, the faith-based leaders, the businesses, and the individuals who continue to make smart choices to reduce transmissible moments in their organizations and find alternatives for how to continue to work, keep their missions alive and going. And again, we know that all of these mitigation actions have real consequences. And so that's why, again, we're not asking businesses or others to make changes to their business model without support, because while this may be unprecedented in terms of us asking the business community and others to make changes. It's also unprecedented the amount of support that we're giving to those organizations, and we'll talk about that later on in this conference. But right now, let's jump into some numbers. This past 7 days, we had 5,614 new cases and over 4,200 people that were recovered, and of course, sadly, 52 deaths in the last week. And that brings us to a slightly higher new record of 63 active cases, up 13 from yesterday. The 11.3% rate for 7 days in North Dakota is a new high for North Dakota. There are many states that have lived in double digits level for months during this pandemic. These are our first days being in double digits. It's territory that we had hoped to avoid. As you saw from the slide earlier, we're doing substantially better than most of our neighbors, where we have other neighbors in this area that have, at the state level, that have 30+% positivity rates. So from a positivity rate standpoint, we feel in terms of the storm, we're weathering it better than others. We are doing far more testing than other states are. That is a positive thing, because that's helping us identify particularly asymptomatic cases, which then, when they isolate, can help slow the spread. This week does mark a huge milestone for testing for North Dakota. We are again leading the nation in this regard, and we have now completed more than one test for the equivalent of every North Dakota resident. So that's 799,000. Just about by tomorrow, it'll cross 800,000 tests in a state with 760,000 citizens, and that includes testing 279,000 plus unique North Dakotans, and others have been, including those people, have been tested more than once. Our testing in long-term care, not just in skilled nursing, but in basic care and in assisted living, both residents and care workers, again, viewed as a best practice. Many in the nation have not been able to catch up with that. And so, again, credit goes out to all the people that were involved in building up our in-state testing capacity. Yesterday, we did distribute, we've got some new testing tools coming on the way. For the first time, we're testing kits, rapid tests that only take saliva as a form of a test, and those are going to Fargo, Grand Forks, Minot, Bismarck, Dickinson, and Williston Public Health to be used as part of their testing capability. You might also recall that last spring, when Minnesota was getting hit hard, that we were able to conduct testing in our neighboring Clay County in Minnesota, part of the Fargo, Moorhead, West Fargo metro area. We were grateful to receive word this week from Minnesota Governor Tim Walz that they're making saliva testing in Clay County as they move to do that, but they're going to allow that to be open to residents in Cass County. And again, they expressed their gratitude for North Dakota conducting significant testing for Minnesota's last spring and summer. They're opening this Moorhead testing site to North Dakotans through December 30th or until they reach the number of tests that North Dakota provided to Minnesota. So like a good neighbor, Minnesota is going to be helping to test North Dakotans till we sort of match equivalency. We really appreciate that, because of course it is one community with I think 70,000 or more bridge crossings going back and forth between those two communities every day. They really are one community. We've got long-term care facilities that are operated by the same operator on both sides of the river. We have people that work on both, live in one community and work in the other. And so the integration there, much like we have here in Bismarck-Mandan, but dealing with the complexity of two states, it's great to have that collaboration with Minnesota. The BINEX Now tests, which we're receiving from the federal government, we're getting ready to deploy those soon, and those will be deployed. We're doing some validation testing on those right now, and then working on the IT systems to make sure we can get those rapid 15-minute tests into our systems, but we intend to start rolling those out in long-term care to help with residents, with workers, and potentially to help facilitate visitation. Our 14-day positive rolling average, this is slightly lower than our 7-day because we've got rising numbers. The 14-day always lags whether you're going up or down to a 7-day. But again, this is new territory, rising above 10% for the first time since we've been in the pandemic. I want to spend a minute talking about underlying health conditions. When we've been reporting those that have passed away with COVID, we've been always saying that the majority of them have underlying health conditions. Feedback that we've received from local public health and from the medical community, perhaps because we included those words, those are the words that come off of the death certificates, and so we are. Perhaps people think that by saying that somehow we're trying to downplay the seriousness of this disease. There's certainly more known about this disease now than there was at the time, and there's more known about the tie between underlying conditions and who is at most risk. One thing for sure, we know from the death statistics that this continues to be particularly challenging for people with advanced age, and as it is here in North Dakota, as it is around the country, the majority of those people who have passed either with or from COVID in North Dakota have been over the age of 70. But again, when we take a look at populations, one of the good things about North Dakota is people live long lives here. We have over 15% of the state population, or almost 115,000 individuals that are over age 65. So that's a group that's at risk. But when we've got this broader list of things that could lead to be considering a health condition which gives you a more risk of either serious illness or death from COVID. It includes things like cancer, like heart disease, like obesity, like chronic kidney disease, diabetes, asthma, and certainly smoking is also something that's been added to the list. So then we say, well, then how many North Dakotans have one or more of these underlying health conditions? Well, the sad news on that is that it's about 66% of the state of North Dakota has at least one of these conditions, and there are others included being like immunocompromised or people that might have recovered from cancer. So we don't want to give anyone a false sense of security surrounding their risk. So beginning tomorrow, when we're announcing the death certificates, we're removing the underlying health conditions from the news release. But if you want more detailed information on deaths, visit the dashboard at health.nd.gov coronavirus. And again, I know that as we tend to, during this, try to look at state-by-state comparisons. We're doing that here today on positivity rates. But when it comes to the death certificates, there's another level of challenge because we do know that states are reporting deaths differently. And so I'm sure this will be debated long after the pandemic is gone, but state-by-state comparisons can be challenging based on differences that the states are using in their coroner's office and others for how they're reporting coronavirus either with or from COVID. When we go to active cases across the state, I mean, again, this is the thing where we talk about our numbers headed in the wrong direction. We now have, again, we're in a position where every single county in North Dakota has at least one active case. The highest totals of active cases remain centered in some of our most populous region. That makes sense. With Cass at 1347 and Burley Morton being very similar combined, almost identical in that 1353 range. Grand Forks 672, Ward 623, Morton 341. I was including that in the Burley ones earlier. Williams 200 and Stark 196. The good news on this chart, the darker it is, then that's the more cases that you have. But if we flip to the active case rates, which is again dividing cases by population. We know that several weeks ago, Williams and Stark were among our highest in terms of cases per 1,000 residents. They've come down off of that. Some of our smaller counties that have had outbreaks have popped up on these lists, and we want to be very cautious not to make the same mistake the national media regularly does. So we're not going to, call out and write a statewide story about about a very small county with a very low population that has a few number of cases, but on a per capita, they may be on the top of this list. But we would say again that there has been some positive movement in some of the western counties, and I'd say in the eastern part of the state in Burley-Morton, we continue to still go the wrong direction. With that, relative to the county levels, which we went into effect last Friday, we are not changing any of those today. We know it takes time for businesses to adopt. It takes time for people to sort through this. We'll continue to monitor risk levels, and we will be potentially making some additional changes next Thursday at our press briefing. When we take a look at this slide, one addition that we do have added on here is the 5 tribal nations with which we share borders. We continue to work closely with our tribes and they're doing work. Some of them have put in mask mandates and have had really strong masking throughout this, and we are going to continue to work with them, whether it's on testing or hospital capacity, to make sure that we continue to partner with them and whatever challenges they're seeing and whatever resources they may or may not have through the federal Indian health system. We do have on that chart that was up, we still have 4 counties that remain at the new normal or the blue level, 17 at the low risk or green, 15 at moderate risk, and 16 counties in high. And so again, if you're in a moderate or high risk county, which represents the majority of the population of our state, again, good time to pay attention. The active support of all of our local leaders and North Dakotans is one of the best tools we have to slow and stop the spread. Otherwise, we'll continue heading in a negative direction. And your actions as individuals and as communities can help drive a positive trend. And hopefully in the future, if we all are in this together, we'll continue to be moving in the right direction. So as I close out that section, I would put out again this challenge. Since we are 4 weeks away from Thanksgiving, I'll call this the Thanksgiving Challenge, but I would challenge every county and every community that's on that chart right now to have better numbers at Thanksgiving than you do today. That's the challenge, and we'll mark what your starting point is now, and we'll see who's going to be on the leaderboard in terms of taking that down to being having the most positive improvements between now and Thanksgiving. I want to also talk about contact tracing. We know that from the beginning of this, the testing and contact tracing work absolutely together. Both of them are invaluable tools, and they help guide the response of our resources. In addition to building some of the most robust testing, because we were testing at levels anywhere from 2 to, in some cases, 9 times more per capita than other states. Commensurately, the fact that we were able to keep up with contact tracing meant that we had, if we were keeping up with contact tracing, which we were till last weekend, that meant that our contact tracers were also doing more contact tracing per capita than almost any other state. We've gone from less than 10 to over 450 trained contact tracers, and I want to thank them because that's their hard work, their dedication, and whether those were members of the North Dakota Department of Health, Department of Emergency Services, North Dakota IT Department, North Dakota National Guard, lots of people helped build that capacity. When we had the big increases last week in certain parts of the state, we did get overwhelmed. So we had a blip where we had a backlog that is extended resulted in extended notification times for positive results. Thanks to decisive action and quick action this week by a number of people, the North Dakota Department of Health, along with the North Dakota National Guard, has successfully resolved the backlog of notifications. We had got over 50 additional North Dakota National Guard soldiers added to that effort, and more than 800 North Dakotans were notified, and we dug through the backlog in a day and a half. And as the third thing that I want to say is that we also know that, hey, we're doing stuff which has largely been a manual process over the years, that we continue to add more automation. We've done this throughout with the contact tracing, but we've added a new capability. It was launched this morning for the first time, and 250 people were notified this morning that they were a positive case, delivering automated notifications. People can choose to be notified either by text or by email. When you receive those, you'll know it's from the Department of Health. You'll be asked to submit some personal information that confirms it's you, and then you'll get your results. And then I would also, again, say that for contact tracing for healthcare settings, K-12 schools, university systems are going to continue as usual, which is the teams that we have in place will continue working, doing in-person contact tracing, again, for healthcare workers, K-12 schools, university systems, and healthcare settings includes long-term care. So we'll continue with our resource against that. If you're an individual, you sign up for this, you could be notified automatically, get the results faster. That's going to help you make choices. There are new videos that are out on the North Dakota Department of Health website, and I think that some people were reacting that we were somehow asking people to do their own contact tracing. I was kind of shocked when I saw a reaction to that, because I would hope that throughout this pandemic, or even if it wasn't a pandemic, if you had the flu or some infectious disease and you found out you were positive, I would hope that you would be contacting the people you'd been around to say, hello, coworkers, I've got XYZ and I've been contagious. I thought I would let you know. So this is, again, part of that, the traditional North Dakota spirit of caring about our neighbors. And so now we've created tools. There's some short videos out there that help you understand what to do, and you can forward those videos to others and let them know that you yourself may be positive. But I would, again, hopefully we're providing a tool to support something that's been going on all along. We also, prior to this, did have a system that delivered automated notifications to individuals with negative test results, and that system will continue to work and has been working well. And of course, that's the majority, even right now. When at a 11% rate, that means that 89% of the people we have to notify are negative. And so that automated system working well. Now we've brought that over and are going to roll that out for positives. But again, grateful to the work of the contact tracers and everybody who worked to resolve that backlog, and everybody in IT that worked to bring in these new systems. Related to close contacts is the new guidelines we offered several weeks ago regarding the close contact and whether close contacts had to quarantine or not. We do have some information coming out of the schools. We know that masks work. We know that wearing them can help keep others safe. And in school settings, we had identified there were 300 individuals that were identified as a close contact to a positive. In 226 of these cases, so way more than 2/3 of that, 226, both the person who tested positive and the close contact were wearing masks. So this has allowed healthy young people who have very little risk of hospitalization. They're very likely not going to take any hospital capacity, almost negligible risk of death. Those healthy young individuals, if they're both wearing masks, then do not have to quarantine. They can continue to wear their mask properly and attend their sports and school, etc. This is helping keep our schools open and our students in school, helps them with all their social and emotional learning. And again, this was an innovative new approach to create an incentive for mask wearing. And again, the 74 individuals that were required to quarantine, a good reminder for others that if you were both wearing your masks, then you wouldn't have to be quarantining. So again, particularly at the school level, there's a strong incentive now for everyone to do their part and wear masks when you're not able to socially distance. Next topic is new school dashboard. We have, of course, had one guideline through all of this, whether it's any agency in the state government, and even before the pandemic, we were committed in our administration to transparency. There's a number of things that have gone on that have helped us increase transparency, whether that's from OMB or whether it's through the Department of Health, but continually updating the information that we're sharing. North Dakota is going to be adding a new dashboard, the K-12 COVID dashboard. This is another layer of transparency that constituents, whether they're parents or teachers or school boards, can help us navigate the complexity of trying to get 120,000 students and their different learning environments in North Dakota all back to a in-school environment safely. This dashboard will provide a glimpse into our K-12 age population and how the virus is impacting student, staff, and communities. It'll do this in a way that protects individual health information, and we're launching this dashboard with school-affiliated tested data from static sites around the state as we work to prepare the remaining data collected. As we work our way through this, we're going to continue to emphasize today. There was some confusion last week, so we'll say it again today. School instructional models, and the school instructional models might include, are you face-to-face, are you hybrid, are you distance? School instructional models are separate from any Smart Restart County colors. School districts, their school boards, their superintendents can make those decisions, and ultimately a parent can make the decision about where and how their student is going to be is going to receive their education. But again, those are unhinged from the Smart Restart. We want our kids in school. The data from around the country indicates that they can be there safely, and so again, this new dashboard will help everybody have information. So I'm grateful again to the NDIT department, the Department of Public Instruction, and especially to Superintendent Baszler for her leadership. And that website is going to be available at the health.nd.gov under the schools link. And so take a look there. And as I said earlier, the Superintendent Baszler will be here for any questions related to K-12. Next topic has to do with the relief side that we're doing for individuals and businesses and support of healthcare through the coronavirus relief funds. As we've talked about throughout this, we've had, I'd say again, unparalleled or without parallel in the history of the state, collaboration between the executive branch, the agencies, and the legislature and legislative leadership during a time when the legislature is not in session. Whether it's calls and meetings that are happening every day, or the work that's occurred through the Emergency Commission in the budget section, there's been great work to act with both care and expediency to allocate North Dakota's $1.25 billion share of the CARES Act coronavirus relief funds. In an effort to get this deployed early, that was part of the strategy, because having money literally in the bank or in the Bank of North Dakota that wasn't in the hands of citizens or businesses or healthcare organizations or our schools would not helping anyone. So we had a strategy early on to try to make thoughtful, careful decisions about how we could get the dollars out. And of course, following the federal guidelines, this is money that could not be in any existing budget between beginning of March and December 30th. So it could not be part of any state budget prior to that. It had to be COVID related, and there's a number of other elements that were included in there, but this provided some guardrails, which we have followed closely throughout this. But we have had some turn back. We got that money out early, which was great, but some of it we've been able to be more efficient, and so when we have money that's come back today, the Emergency Commission had an opportunity to consider $220 million that was turned back. Some of that was because we learned there was a large allocation that was made for emergency loan programs at the Bank of North Dakota. Turns out during this time frame there was not an appetite for businesses to add more debt to their balance sheets. One of the good news things is we also had a turn back of a significant turnback from our unemployment insurance fund, and the reason for that was because we've been able to keep our economy open. We've had a record number of people come off the unemployment rolls, and it was announced yesterday that we, as a state, have the 4th lowest unemployment in the nation at 3.8%, and this is a credit to the business community and to the state working together to keep our economy open, because this is a 3.8, and we're still in the middle of a significant downturn in ag and in energy, and so again, this is really, really remarkable. So great work, team, on that. There was changes that were made in the rules, FEMA reimbursement to the Department of Health, and also to our Adjutant General, General Dorman, the National Guard, and Department of Emergency Services. With those changes in reimbursement, some of the dollars we had allocated for coronavirus relief funds can be accessed through FEMA dollars, so those were able to be turned back. And then we also had, through Commerce, had put together a program for energy resiliency grants, but we know that those, under the current guidelines, were not going to be fully utilized before the end of the year. And so those were some of the bigger areas of potential turnback. But what we have done, the highlights of the repurposing this, is that with the action today by the Emergency Commission consists of the majority leaders and the two chairmen of the House and Senate Appropriations, along with the Secretary of State and myself. That group of 6 advanced these recommendations, which will be reviewed next week by the 24-member legislative budget section. But as of today, approvals that came out, we're going forward, is 33.8 million going to K-12 on top of the roughly 30 million that was allocated before, so that brings a total of almost $64 million going on top of K-12, and that's on top of already North Dakota, one of the highest in the nation, with $10,000 of state aid per student. Another $64 million to help the schools with COVID related. This round of dollars that are going out today will allow more flexibility for schools, whether that's on tech support, mental and behavioral health support for students and staff, personnel-related costs, including substitute teachers, upgrades to ventilation systems and other physical plant or building improvements, and additional training for instructors and staff on the new teaching and learning environment. We also today had $10 million going to the 6 large referral hospitals, 2 in Bismarck, 2 in Fargo, 1 in Grand Forks and Minot. These hospitals will continue to play a critical role in expanding hospital capacity if needed in the coming months ahead, when we've got flu season, and we typically always have higher demand for hospital care in the wintertime in North Dakota, but when we have the seasonal demand plus COVID, that we feel that these are the organizations that need that. Particularly, this grant is going to allow them to apply these grants towards incentives, whether it's paying bonuses for overtime, whether it's incentive packages for people working additional shifts. But all of these things are more cost effective than hiring more out-of-state contract nurses. We know that has to happen, but as we compete with other states for contract nurses, in some cases in the region, coming off of our weekly call with the hospital leaders from across the state, that in some places are charging as much as $150 an hour for a contract nurse. That money doesn't go to the contract nurse, it goes to a company. The nurse might get paid a fraction of that, but we want to, for that sort of labor arbitrage that can happen during a critical time like this, we want to provide the resources so that our large referral hospitals can help put money in the pockets of North Dakota healthcare workers that are working exceptionally hard, and help retain them, or to get people to come off the sidelines who may still have a license but haven't been actively on the front lines. This may help them with that. So again, I want to say thanks to the hospital leaders that we continue to work with, who are all committed to a planning process that's going to allow us to make sure that we're making the full and best use of the North Dakota's capacity. $29 million is going towards additional grants to support our hospitality hospitality industry. And again, we're repurposing $25 million of the existing economic resiliency grant. So this is going to be a $54 million grant program. We know that that those in the hospitality industry have been those that have been some have been the most hard hit as travel has been reduced and as guidelines sometimes include for more social distancing within hospitality organizations. If we're asking them to do their part to help slow the spread, we also want to stand up and give them support to help them do that. And these grants will provide up to $25,000 per location. Other things that quickly going through this thing on the money that was approved today, the Emergency Commission previously supported cities and counties in August, providing $59 million of CRF funds to reimburse them for law enforcement costs for the March through the earlier part of the summer, and we're now extending that for 5 more months. It's about $12 million a month. That will bring the grand total for the political subs to about $122 million to help cover the costs of law enforcement payroll costs. Those public safety payroll costs, they're considered allowable expense, but so they are allowable, so the payment goes out. They can easy for us to calculate what those dollars are. If a county or a local community had already covered that payroll cost, then this dollar grant, which is sent to cover payroll costs, they can use those dollars for others, whether it's first responders, for fire, for other needs that they may have within the city. So these are dollars that will be transferable within those communities once they receive them. We've also repurposed nearly $16 million to our Department of Human Services for a number of great things. We have continuation of the very successful Child Care Emergency Operations Grant, continuing that through December. That's $8 million. Long-term care and skilled nursing facility, environmental improvement that includes air purification and HVAC systems, over $3 million. Community-based behavioral health services, critically important right now, $1.7 million. The emergency rent bridge program, which thankfully there has not been much demand for, but we are continuing to support that for people that may be falling out of the bottom of the keeping people housed, as opposed to the more expensive approach for them to become homeless, to help them get through this time, $400,000. And then the Great Plains Food Bank and Senior Nutrition Services, $420,000. So again, those are all fantastic. And one of the other ones which was approved today for the energy industry. The energy industry is a critical part. It's about 9% of the GDP in North Dakota, but it represents over 53% of the North Dakota state tax revenue. Let me say that again, 9% of GDP, 53% of state tax revenue. It's critical that we support the workers in this industry, particularly those in North Dakota who've been put out of work, and we've found smart ways to do that and protect the environment. There was about $40 million that was spent earlier to help reclaim abandoned wells and plug those. That helped us keep employment for crews in North Dakota, but it also helped us solve an environmental issue. We were one of the first to launch that. That was copied by other states. And again, here we're repurposing some of those dollars that could not be spent because of the winter weather coming and the need to get this money expended by December 30th. We're repurposing $16 million to provide an incentive for to buy water acquisition. Water is something that is needed for both producing and also disposal after a well is fracked. And this will incentivize the completion of 80 wells, which will preserve 500 to 1,000 jobs in the oil fields. And each of these wells, when produced, will produce millions of dollars of tax revenue to the state. It takes about $150,000 of sales tax for all the other things they they have to buy to complete a well. And so I have no doubt that this will be the highest return on investment for taxpayers of any CARES Act dollars we've used. And with 80 additional wells running, that'll help maintain oil production at the levels it is through the next summer, which again will help stabilize the entire budgets and the revenue, with 53% of state tax revenue coming from that sector. Then there isn't a single budget, whether it's K-12 or healthcare or infrastructure, public safety, the universities, every single budget is touched by the energy sector. So again, finding ways to preserve employment for North Dakotans, buying North Dakota products to help keep that industry going. So with that, in summary, I've got a slide here of the $1.25 billion, and I think again North Dakotans can all feel inspired by this chart, because when we take a look at the left side of this, which is the top left corner, economic support for businesses, lower left, economic support for individuals. These will represent well over half of the pie chart here. So you're talking about close to $700 million that's gone to help support those individuals who've been asked to make changes or sacrifices, who've been affected by the downturn in the economy because of this pandemic. And then on the right-hand side of that slide, we've been able to, for only 16% of this has gone towards the continuation of government services. And then the upper right-hand corner, public health and safety, that includes everything with the Department of Health and Human Services and everything we're doing on that right-hand side of the page to support local political subdivisions. So fantastic balance. And again, I know that other states that early on got caught up in the pandemic at a level like we saw in states in the Northeast, where 1,000 people were dying a day in some of the Northeast states, that most of their dollars went towards fighting the pandemic, and we've been able to have more than half go towards supporting individuals and businesses. One of the reasons, when you look at that chart, it's one of the reasons why our unemployment is at 3.8%. So with that, again, I'd conclude on the coronavirus relief funds by again sharing my gratitude with the legislative leaders and all those that serve on the Emergency Commission and Budget section, and many more that have been in discussions on how to appropriately invest these funds for North Dakota to help us support the mission we've had all along, which is saving lives and saving the livelihoods.